Hi, I'm Claire from Sydney Advanced Physiotherapy, and I'm going to talk to you about pain related to your pelvic floor. So you might have heard that you can have a weak pelvic floor, and that can lead to problems like leaking urine or pelvic organ prolapse, but lots of people aren't aware that you can also have a really tight, overactive pelvic floor. If you have a tight pelvic floor, that can lead to problems like constipation, trouble even passing urine as well. Sex can be painful if your pelvic floor is too tight, and you might have a history of things like recurrent urinary tract infections or thrush. If your pelvic floor is really tight, it can also affect your hips as well and your tummy muscles because your pelvic floor is really close to your hips. So sometimes a tight pelvic floor can pull the hips out of their normal alignment and make it hard for them to function well. So hip pain can be a symptom of a tight pelvic floor. So I've got some pictures here. So this is a side view of the deep pelvic floor muscles and the anal sphincter muscle. So this is the front with the pubic bone, and that's the back with the tailbone. The bladder, uterus and bowel are in between, and you can see that the muscles are like a big U shape around the back. If these muscles are too tight, then they're going to pull the bowel forward and make a sharp angle here, which is going to make it hard for the stool to pass out when you're having a bowel motion. So that's how a tight pelvic floor can give you constipation. The next picture I've got here is looking down into the top of the pelvis, and you can see the pelvis is just like a ring of bone with the muscles and ligaments filling in the hole at the bottom. Here's the urethra, the vagina and the rectum, the bowel. And again, you can see that U-shaped muscle around the back. So again, if that's really tight pulling forward, you're going to have trouble with the function of these tubes. Your hips sit out to the side here. So you can see that close relationship between the pelvic floor and the hips. If I just turn this page around, this view is looking up between the legs. So there's the anus, vagina and urethra again. And you can see that there are little muscles that are closer to the surface of the skin. And these ones are kind of like sphincters or circle muscles around the vaginal and urethral openings. So you can probably already see how if these muscles are tight and overactive, that's going to make sex pretty uncomfortable or even impossible for some women. So physiotherapy can help with an overactive pelvic floor by teaching you to hold your body better, to switch off those overactive muscles. We can also look at massage techniques or self-release techniques to help decrease the spasm in those muscles. And we can also go looking elsewhere in the body to see where you might be holding tension or increasing the downward pressure on your pelvic floor, and try and change those postural factors to make sure you're not always gripping with your pelvic floor. So to explain a little bit more about downward pressure on your pelvic floor, you might have noticed that no matter how you try and lose weight or do exercise, you always have a little bubble belly at the bottom, and we call this a pressure belly. This is created when there's no give in the pelvic floor muscles. As your diaphragm moves down when you breathe, your pelvic floor muscles can't relax enough to accommodate that pressure change. And so the pressure has to go somewhere, and so it's pouching out into this little pooch belly. Sometimes we find that you've got a twist in your body, and this can affect your pelvic floor because it needs to maybe work harder on one side to accommodate the twist in the system. So we can help by figuring out where that twist is, fixing it, and then retraining your pelvic floor. So sometimes people think that it's good to have a tight pelvic floor because we hear so much about having a weak pelvic floor and how that can cause problems. So I just want to emphasize that when you release the pelvic floor, that actually makes your whole body work better because you need to be able to lengthen and shorten the muscle through its full range of motion for everything to work well. So for example, if you're training your biceps, if you're doing a bicep curl, you don't want to just be strong up here. You need to be able to lower your arm all the way and bend it all the way. And it's the same with your pelvic floor. The pelvic floor needs to be able to drop and to lift. Sometimes the pelvic floor muscles and the surrounding tissues, the labia and the vulva, can be so sensitive that even light touch is uncomfortable or painful. So physiotherapy can help with this using something called graded desensitization, where we gradually train the nervous system to be able to accept different types of stimulus, so light touch, pressure, stretch, etc., until things like sex become more manageable. If you have any questions about this video or any of the other videos you've seen, please don't hesitate to get in touch. You can call us at the number below, and please share the video on Facebook as well, because we want as many people as possible to have this information. Thanks.